All right, good morning. Pontoon this morning, Little Big Town here on 105.9 WTNJ. You're listening to your Morning Cup with Bob, and I've got a pop-in guest, as said, Karen Bowling, CEO of WVU Medicine, Princeton Community Hospital. Welcome, Karen. How are you this morning?
I'm great. Thank you for having me.
Oh my gosh, I'm so excited to see you today. I hadn't seen you since the Dancing with the Stars reveal for season 12.
Well, that was an exciting night. After last year and Dancing with the Stars, I'm always interested to see what's up next and who's up next. And it was a great event for me, and I was really glad to be able to contribute. I'm a big supporter of the United Way of Southern West Virginia.
Well, we greatly have that in common. We do love that organization, as well as our Trina Daisel, our executive director, right?
She's awesome.
She is.
I know we both love her.
We do, very much so. All right, well, you had a big announcement last Wednesday or so, right, on the 21st?
Yes, we did. It was so much fun. It was a children's community event. We are announcing our formal partnership with WVU Medicine Children's Hospital. It's been something we've been working on for actually about a year. We've done some preliminary work. For example, we worked on our emergency department, and we were able to get certified Always Ready for Kids. An outside entity comes in, and they actually evaluate your emergency department to make sure you're doing everything you need to take care of children. We've been working on telemedicine. We have a very large telemedicine clinic with 16 specialties from Morgantown, where our academic medical physicians can actually see kids in Princeton. We have a nurse practitioner that sees them, and then they're on TV, so to speak, with physicians there. And that's wonderful for our community because children don't have to travel all the way to Morgantown. They can get those services close to home. We have a pediatric hospitalist program, as well as great community pediatricians, and we'll be using the same protocols they do in Morgantown. So this affiliation is really a way for us to connect the dots up to the Children's Hospital, which I believe is extremely important for our community to know we have that kind of resource locally close to home.
That resource definitely does create such a huge impact in that area, and it's sure every area that you connect with.
Oh, absolutely. I mean, children are important. I tell everyone that's our future, and we want to be able to take care of them, and we want to make sure that they're getting the best care possible. And when you're connected to an academic medical center, that really should give you, as a parent, a sense of security to know that, if your child comes to WVU Medicine Prince Community Hospital, that we're going to have people that really, if you're admitted to the hospital, we have the ability to consult physicians up at the Children's Hospital, which is just phenomenal. As an example, your child comes in with something we're not quite sure what it might be. We can connect up to Morgantown. They can let us know if, yes, you can continue to take care of that child in Princeton, and here are, some consultative advice, or they might say, hey, we need to get your child the child to Morgantown, and then we make those arrangements. So it is really important for us to focus on children's health. I'm a firm believer that, children really need those kind of services locally and not have to travel for them. And it's been our goal to be able to provide that at Prince Community Hospital. And with this affiliation with WVU Medicine Children's, we've been able to. So I'm super excited.
It's a super exciting collaboration. I'm going to call it that. Yeah, there you go. All right, what else do you have going on down in the Princeton Bluefield area?
Well, we have another great opportunity for everyone to just be aware of, and that is we are expanding our Bluefield campus. On June the 5th, we're doing a groundbreaking, and we're going to be expanding services in the Bluefield area. We currently have a behavioral health center. We're going to be actually groundbreaking for moving our emergency department over to that campus and expanding outpatient services like CT, MRI, various kind of respiratory programs, lab. We'll have 10 observation beds. We've just been so busy that we felt like it's, important for us to expand. And that's an almost $25 million project in that geographic area. So we can't wait for the groundbreaking in June.
Well, that's a lot going on in Princeton Bluefield area there, Karen Bowling.
Yes, it is. And I love every minute of it. Everybody knows I'm from Southern West Virginia. And Wyoming County girl, I tell people. And, one of my dreams has really just been to see what we could do to expand services in Southern West Virginia. I felt like for so many years we've been underserved. And so, part of my job as a leader to make sure that we can meet the needs of the people in our community. And that's what we're trying to do.
Well, there you go, folks. Karen Bowling, CEO of WVU Medicine, Princeton Community Hospital. Karen, thank you for coming in this morning.
Thank you for inviting me. It was nice to see you.
You too, love. All right, Dylan Scott, whatever he'll never have, coming up next.